Good morning, everyone. My name is Dr. Doreen Akum-Yong, a medical officer at Superior Medical Center. And today I'm going to talk to you briefly about the breast in honor of Breast Cancer Awareness Month. So, we are going to start by talking about the structure of the breast. First of all, the breast is primarily the organ of a female adult. So it's an organ that is meant for milk production in a female adult. So we'll briefly go through the structure and then the changes that the breast goes through. So this is a small um, diagram that shows the breast in the inside of the breast. So you can see that there's a lot, all these yellow things, these are fat. This is fat. So the breast is made up of a lot of fat and a lot of glands. So these round things, they are called lobules. And these lobules, they produce the milk. That's when a woman has a baby, she used to feed the baby. So these are the lobules, and the lobules are connected by ducts, and that's where the milk passes through to come out of the woman's nipple. So this is the muscle. The muscle is what the breast is attached on, but the breast itself does not have any muscle. So the breast is made up of a lot of fat, a lot of glands, and a lot of connective tissue, which makes up the bulk of the breast. So breast production starts in the mother's womb, typically when a baby is forming at around 6 weeks of conception. So at birth, both male and female have the same structure of breast. Sometimes in babies, because of the influence of the hormones of the mother, babies may be born with nipples that are a bit swollen and produce milk for about a week or two. But this is normal and it resolves on its own. It's just as a result of the hormones that the mother's body produced during pregnancy. So changes typically in the breast start at puberty. Puberty is when both men, girls and boys begin to experience secondary sexual characteristics. Their body begins to make changes to allow them to be able to get pregnant. So in a female, typically between the ages of 9 to 10, it may be earlier or later in some females, the breast begins to develop. So the nipples begin to develop, the glands begin to develop. So you would see a girl that used to have a flat chest suddenly begin to develop, and it grows in stages. So between the ages of about 9 to maybe about 15 or 14 or 15, that's when the breast matures to the full extent. And during the course of a woman's life, the breast goes through so many changes because our bodies typically goes through a lot of changes and are under a lot of influence from hormones. So for instance, these changes that occur during puberty, they are influenced by two hormones we call estrogen and progesterone, which increase when a girl begins her puberty. When a girl starts menstruating, during the menstrual cycle, there are a lot of hormones that are at play. But in a certain aspect of the menstrual cycle, estrogen and progesterone becomes elevated. And during this period, the breast tends to swell and it tends to get a little bit painful. So some of you may realize that during your period, sometimes you get a little pain when you touch your breast, you feel a little pain, and that is normal because during that point when estrogen and progesterone goes up, your breast begin to swell. Your body is preparing, at that point your body is preparing itself to carry a pregnancy. But then when it doesn't occur in the next phase of your menstrual cycle begins, that also goes down. When you get pregnant, these hormones that I mentioned, estrogen and progesterone, are on the high. So you begin to notice right from conception, there are changes in your breast. It begins to become big. The glands, these glands, the lobules that produce the milk, become very enlarged because they are preparing to start producing milk for your baby. The ducts also enlarge, the fibrous tissue also enlarges. So you notice that your breast increases significantly in size, and most people will also experience a significant reduction after they are done breastfeeding. All these are changes that the breast goes through. And then also during menopause, Once you get to menopause, the major change is that the hormones estrogen and progesterone that were affecting the growth of the breast go down or begin to go down. So all the changes that you were experiencing, you begin to experience the reverse. So now the glands begin to shrink up because your body is preparing itself to not produce milk anymore. The fatty part also reduces, the connective tissue also reduces. So you realize that the strength in the breast falls and then the breast begins to sag. So those are the changes that the breast will typically go through during menopause. So at this point, we would like to include the how to do the self breast examination and the best time to do self breast examination. So as you realize, I mentioned that there are certain times that your breast typically enlarges and then it becomes more painful. So for instance, during your period, it is we wouldn't advise that you do a self check during your period because during that time your breast would naturally become bigger. It will appear more lobulated. It will appear to have a lot of fat lobules in it, and you think that what you are palpating is mass, but it's just fat globules in your breast. And it will also be a bit painful to do it during then. So we recommend a week after your menses as one of the best times to do the self breast examination check. So this has been a brief discussion on the structure and the function of the breast. So now you know more about the changes that naturally occur in your breast. So this is to help you identify the things that are not normal. So in this month of breast cancer awareness, we want you to know what is normal so that when you see what is not right, you can immediately come to the hospital or come to the clinic and a proper breast examination check will be done for you. Thank you.